I can hear you on your screen, please. If you can hear me right now, just type, I can hear you. If you can see me as well, just type it. Okay, I can see from Adenike and Matthew, I can hear you. Welcome, 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 everyone. Just keep putting it down. Yes, I can hear you. Oregbemi. Shegun, I can hear you. Yes, anytime day I can hear you. I can see you as well. Thank you very much. Just keep them coming. Keep them coming. So you're welcome to this CPR and First Aid training. Yes, I can see a lot of people telling me they're excited. Yes, I'm excited, Chidimaldo. Excited as well, Justin Barry Pefe. My name is Emmanuel Erahi, so I'm here to just anchor this session today. So I have a lot of exciting things to take you through. So I just want you to know that we have a lot in store for you, and we are here to ensure that you learn from today's session. And I would like everybody ensure that your microphones are all muted, and ensure that if you have any question, you either use the raise of hand feature on this Zoom application, or you just drop it in the chat room and we'll do well to attend to you. I want to advise you that you try to stay civil and stay civilized. Don't share anything that will be a little bit distracting, or make any other side comment that will be a little bit distracting. If you have any serious issue, just ensure that you drop it. And if you have any question, just write it down, send it to the chat room or write it down, and during the question and answer session, we'll give you the opportunity to ask your question. And also during the polling session, we'll give you the opportunity to ask your questions. But also you can drop your question in the chat room and we'll do well to attend to you. Thank you very much. Right now, I'll just give you a brief introduction about who we are. A lot of people are asking me this question: who are you guys? Who are you guys? Now I'll tell you who we are. We are ERA. ERA simply means Emergency Response Africa. Now we are a fast-paced organization, that is technological organization, that is changing how medical emergencies are being managed. We're building the largest network of first responders and also emergency-ready hospitals across Nigeria. But we are spread across Africa, but we're using Nigeria as a launching pad right now. We are connecting emergency victims using the help of technology. So today we are going to learn a lot. I don't want to go and spill the whole everything about ERA. I just want you to just pay attention, get engaged, and we're going to have a lot of exciting session. So now let's meet you. Just drop your name and your location. You already know about me. My name is Emmanuel Erahi. I stay in Lagos. So in the chat room, just quickly drop your name and your location and your expectations for this training. Quickly do that quickly, and we'll just move to the next session. So drop your names and your location, where you are. Your name, my name is Emmanuel Erahi. I'm in Lagos. I'm seeing Jane from Surulere, Nandi from Imo. Wow. Barry Pefe from Port Harcourt. Nice to meet you. You want to learn a lot. You will learn a lot, and I'm sure you will learn a lot. Palm Israel. And introduce our trainer, Dr. Shehu Adewumi. He is a very exciting personality. He's a medical doctor and a health innovator who focuses on user experience design as a centered approach. Now, you already know from this first paragraph that he's someone who uses technology to handle or manage medical situations. So he has experience, and he has worked with startups as well as medical schools as well. And he has worked with several organizations such as the Ebola Alert, which is now Aed Alert, Mentally Aware Nigeria Initiative, the Foundation for Professional Development, and several organizations. Shehu is currently the clinical lead at Emergency Response Africa, otherwise known as ERA. He holds a medical degree from the College of Medicine, University of Lagos, Nigeria. Thank you all very much. Please let us give a round of applause to Dr. Shehu Adewumi. Just put a clap emoji in the chat room, and we welcome Dr. Shinwa Delmi. Dr. Shinwa Delmi, the floor is open to you.
Thank you very much, Emmanuel, and welcome everybody to today's session. I hope everybody can see me and everybody can hear me. Please, if you can hear me, could you put in the chat box that you can? And if you can see me, also include that in the chat box. I would like to also share my screen, so please tell me if you can see my screen. Can you all see my screen? Please drop it in the chat box if you can see my screen. Okay, you can see me, you can hear me, and you can also see my screen. Okay, so let us roll today's class. I'd like to share. Like we all registered for CPR and the use of Aed Training, and I hope that today's session is going to be very informative, and it would in itself help you be able to save a life. And the objective of today's course is going to be how to assess a collapsed person, how to perform effective cardiopulmonary resuscitation and rescue breathing, what not to do during a cardiac arrest, when and how to use an automated external defibrillator during a cardiopulmonary resuscitation, and how to perform recovery positioning. Also, we'll be using some tools. To my left, I don't know if you can see my left, but to my left, we'll be using some dummies. We'll be using the automated external defibrillator. We'll also be using a mouth guard for this session. Yeah, and also a sanitizer. It's very important that we always clean everything we use. I know everybody likes stories, so we also have decided to include stories into today's session. Inamdi complained of a slight headache and chest pain in the morning, which was radiating to his shoulder. So he decided to go to the bank to make some transactions. On his arrival, he collapsed and he stopped breathing. As a passerby in the bank, or you came to do some transactions in the bank, what do you think you're going to do? And what do you think people around you are going to do? You can put your answers in the chat box. Do you think you start shouting? Do you think people will start shouting? Do you think people will start praying? Do you think people will actually call an emergency for help? And do you think that people will actually start taking pictures for social media? Yeah, people, somebody said call an emergency service for help. Somebody said people will start shouting. Some people said people will start shouting and they'll also call emergency service for help. Some people are saying they will take pictures and so on and so forth. We will know by the end of this session what is the right thing to do. Let's move on. Yeah, so WHO has suggested in recent statistics, and WHO stands for World Health Organization, has suggested that sudden cardiac arrest is rapidly becoming a leading cause of death around the world. It is very important that a lot of times we Nigerians, we always say, we are too resilient, nothing bad can happen to us, we are protected in children and so forth. And of course, we can be spiritual, that is fine. But we also should note that in Nigeria, as at now, ischemic heart disease is the 8th leading cause of death, according to the Center for Disease Control. So it is very important that you take every lesson that you can learn in this conversation, every step that you can carry out in this conversation, you take it very seriously, because you do not know whose life you may be saving. Also, during the demonstrations, also please follow me, because I believe that when you learn, when you want to learn, you learn by doing. So while I'm demonstrating, if you can also follow my instructions and you also try to demonstrate from your end too, you can easily learn down. And so the idea of trying to resuscitate someone, trying to bring someone to life, is that once the heart stops functioning, or once the heart stops seizing, right, the healthy human brain can actually still survive without oxygen for up to 4 minutes, and at most up to 10 minutes. At 10 minutes, there's almost permanent brain damage, or the person may have been declared dead. So it's very important that once the heart stops breathing, there is still enough oxygen to be given to the brain so that the brain doesn't stop functioning or doesn't suffer permanent damage. Please note this, because we'll be talking about this later. And unfortunately in Nigeria, a typical emergency service response may take up to 10 minutes, imagine. more in Nigeria. And it is during these critical minutes that cardiopulmonary resuscitation can actually provide enough oxygen to the brain. What that means is that, like we mentioned earlier, once the heart stops functioning, or once the heart ceases to function, or once the heart stops doing what it has to do, and what the heart does is it pushes blood to other parts of the body plus the brain, right? And in this blood, there's oxygen blood. So when the blood goes to other parts of the body and our organs and also the brain, our body uses up that oxygen. So the moment the heart stops functioning, there is no enough oxygen to the brain, and the brain can last or can survive nothing more than 4 minutes, because the moment the brain cannot take oxygen after 4 minutes, it will start suffering some damage, and it can lead to permanent damage at 10 minutes. And so it's very important and very crucial. The first 4 to 10 minutes is a crucial time during an emergency. Please, if you're writing on the screen, please erase the screen. Try as much as possible not to touch your screen or use the writing pad on your screen so you don't distract us. Please, the person that wrote on the screen, please, can you kindly clean the screen? Thank you very much. Also, one thing that we also know is that we are currently in a pandemic. And so even you as a first responder, or you as a first aider, or you coming to this class today to learn how to give adequate and appropriate cardiopulmonary resuscitation, you need to protect yourself. We'll be talking more about safety along the class. And what do we want to explain as safety during a pandemic, or safety during COVID-19? There's actually no current specific data to show that COVID-19 is transmissible during while performing cardiopulmonary resuscitation. However, it is very important that when you're having close contact with someone, whether you know the person's COVID status or not, you need to protect yourself. I'll be showing you ways that you can protect yourself. And it is also very important that while you're protecting yourself, you wear appropriate personal protective equipment. For example, you wear your mask, you can wear your gown, you make sure you wear your hand gloves, make sure you wash your hand regularly. Today is hand washing day, and so we can key into that and understand why hand washing is very important. Also, do not give rescue breath. I will explain to you further what rescue breath means. Do not give rescue breath to a confirmed or suspected COVID-19 victim in cardiac arrest. It is very important to don't do that. The only thing you can do as recommended is that you perform continuous compression, which I will show you as time goes on. Chest compressions also, and the use of automated external defibrillator is recommended for every cardiac arrest victim. I don't know if you watch football. There was a certain player that actually had cardiac arrest on the field, and immediately paramedics came to the site and resuscitated the person by actually giving chest compressions, rescue breathing, and automated external defibrillator. But according to the recommendation due to COVID, if you know that there is a suspected COVID-19 case, you can actually just give chest compression for a while, and then when an AED comes up, you give AED. AED means automated external defibrillator. Like I mentioned earlier, always also sanitize and disinfect your tools. Now, a lot of people always confuse cardiac arrest and heart attack together. Even yesterday in the movie, and in the movie, they were saying the person died of heart attack, but it's not true. Now, heart attack can lead to cardiac arrest. Well, cardiac arrest cannot lead to heart attack, and I will explain what that means. So heart attack, right? Let's imagine that my fist is our heart, or it's my heart in particular. You can also imagine that your fist is your own heart, right? If a part of that, my fist now, which is my heart, stops functioning, that is heart attack. It just means that there is an artery that supplies the heart, and it is called coronary artery. When one part of that coronary artery stops functioning, that part of the heart stops functioning. That is what we know as heart attack. Now, a lot of people can, I will explain what heart attack and cardiac arrest is later. Don't let me push more about that, right? So that's heart attack. Heart attack, right, is just, let's imagine this is our fist, and our fist is our heart, right? Heart attack is just when a part of our heart stops functioning. That means there's no blood supply to that part of the heart. And like I mentioned earlier, our body needs oxygen, and the only way we can get oxygen is through blood supply. So our heart supplies blood to all the parts of our body, plus the brain that gives oxygen. The brain needs oxygen as much as all other parts of the body, but the brain needs oxygen the most. And so when somebody falls down and there's a cardiac arrest, means a stoppage of the whole heart from functioning. What then happens is that the heart is not pumping enough blood to other parts of the body plus the brain. And that means that there's not enough oxygen to the parts of the body. And that can be very dangerous. And that is why it's very important for everybody to know at least how to give first aid and how to give cardiopulmonary resuscitation and the use of AED. Like I mentioned, cardiopulmonary resuscitation just stands for cardio, which is heart, pulmonary, which is lungs, resuscitation. You're trying to revive the person by reawakening the heart and also reawakening the lungs. And how you do this is the combination of chest compression and ventilation. Ventilation, which is also known as rescue breathing, which I'll be showing you how to, I'll be demonstrating to you later in this class. Also, please note that while I'm demonstrating, I believe strongly that when you learn by doing, you get better information because you're actually doing it while you're listening. And so when I'm demonstrating, please, you can also follow my lead and go ahead to also demonstrate from your end. And like automated external defibrillator by its name, it's a device that delivers a controlled, number one, precise, number two, shock to the heart, which can also restore the heart's functionality. And this just shows the importance of compression. So when you're compressing the heart then gives enough blood supply to the brain. And remember that the blood to the brain has oxygen. Now, see the blood supply, it's not enough. And so it's not giving enough oxygen. But the moment you start compressing adequately, which I'll be explaining to you what adequate compression means. The moment you start compressing adequately, you give enough blood to the brain, as it has shown above. Now, like I mentioned earlier, giving adequate cardiopulmonary resuscitation or whenever there's a cardiac arrest, you need to understand that in an emergency, when there's cardiac arrest, we must first make sure that we don't do some certain things. For example, don't leave the patient, don't leave the victim, don't leave the person that needs your help. The reason why you are not meant to leave the person is because, number one, while you're resuscitating person, you're meant to monitor the person, you're meant to see bodily changes, whether the person is getting better or the person is still the same or the person is getting worse, right? Also, don't make the person drink water. Don't pour water on the person's face, don't pour only water on the person's face, don't pour oil on the person's face, don't burn the person's face, and so on and so forth. You're not meant to do all of that. You're not meant to, like I mentioned, throw water on the person's face. You're not meant to immediately want to put the person in sitting position. It is very dangerous and very deadly. For example, if someone faints due to a traumatic attack, that means maybe due to trauma, and you're immediately wanting to sit the person down, you can even cause more harm and complicate the situation. Also, don't try to revive the person. You can't revive someone by slapping the person's face or body. So, next question, please. I would like everybody to be interactive when it comes to this. What are your fears and concerns after you've learned today's class and after you are sure that you can give effective cardiopulmonary resuscitation? What do you think will stop you from actually going ahead in case there is a need to give cardiopulmonary resuscitation? Please, I would like everybody to share so that I can read one or two before we move on. What are your fears? What are your concerns? Please drop in the chat box.
Kindly drop your responses in the chat room, and then Dr. Sean will read them and attend to it. Thank you very much.
Fear of performing it wrongly. It's actually a very valid fear. Fear of performing it wrongly. Health status of the person, very important. But by health status, you mean COVID. If you mean status like HIV and AIDS, HIV and AIDS is not transmissible by doing CPR, as far as you protect yourself adequately. Fear of contacting infection through mouth to mouth. Yes, that's actually a valid reason. My fear is that the fact that you may go, sorry, let me quickly read that. A lot of answers are coming in. Anyway, does the size of the person matter? Not necessarily if you know how to give effective cardiopulmonary resuscitation. If there's a crowd there, they will allow you to perform. Yeah, so fear of danger. Yeah. So let's continue with the class. So like you people mentioned earlier, there are some fears that's been listed here. For example, mouth to mouth, harming the person, legal consequences, won't perform properly and physically unable to. And there are solutions for these things, right? So if, like I mentioned earlier, in the pandemic, right? It is suggested that you can actually give chest-only compression. You don't have to do it mouth-to-mouth in a COVID situation. But in other forms of situation, or in other forms where it's not a pandemic, there's a mouth guard that you can use to protect your mouth or the person's mouth. I'll be showing you the mouth guard later, but let me just show you now. So this is a mouth guard. Yeah, and it's portable. You can always carry it everywhere. So that's the mouth guard. Also, arming the person. Do you want to save the person's life, or you are scared that this person is still going to die? You want to arm the person. If you can give effective cardiopulmonary resuscitation, right, you can actually save a person's life. So please go ahead to actually save the person's life. Legal consequences. So there's what we call Samaritan law that actually protects a first aider that gives cardiopulmonary resuscitation to help resuscitate someone. And if you can do it to your best of your ability, I believe strongly that the person will actually be able to revive the person. Won't perform easily. If you go through today's class and you follow every instruction I give, an effective cardiopulmonary resuscitation is very easy to do. Yes, physically unable to do, physically unable to carry out cardiopulmonary resuscitation, you can always do your best. Like I mentioned earlier, an effective cardiopulmonary resuscitation is very easy to do. But then again, you can always call for help. You can have a second responder close by, you can have a third responder close by, so that you can always take turns to try to resuscitate the person. Yeah, like I mentioned earlier, heart attack. Like we mentioned, firstly, heart attack is blockage in coronary artery, which then affects a part of the heart. The person is still conscious. Most times they may complain of chest pain that radiates to their shoulder. Radiation just means that goes to their shoulder and so on and so forth. Or chest pain that makes them not able to move or not able to talk for a short period of time, but the person is still very conscious. Apart from chest pain, they can also have upper body discomfort, total body discomfort on the upper part, which is the chest region. Why cardiac arrest is the heart stops temporarily, which can lead to death. The person is unconscious, and oftentimes there are no previous symptoms. But then again, heart attack can lead to cardiac arrest. Then the person may be gasping. I'll mention that later in the conversation. The person may be gasping, and the person may not be breathing at all. And always remember that oftentimes a cardiac arrest occurs due to a heart attack, and you can also on the number below. Poll time number 1. So there's going to be a poll that will show on your screen now. I'd like everybody to answer according to what we've mentioned and we've taught so far. Emmanuel, please go ahead.
Okay, hold on, Dr. Shem.
Everybody see the poll?
Hello, Dr. Shem. No, just hold on. So can you just go through and then go, we'll come back to this poll quickly, please.
Okay, I can take some questions while we do that, I guess. Yeah, how do I know if it's a cardiac arrest? I'll be mentioning that later. But there are some actions that you can take to know whether it's actually a cardiac arrest, or the person just fainted because of low sugar in the body, or the person just fainted because of some external factors. There are some things that you do. I'll be mentioning that later. Please show the mouth guard a little slower. Okay, somebody said I should show. It's not a mouth guard. So this is how it looks. I hope everyone can see it. It's very portable, but then you don't have to also use this. The other very portable ones you can use just to protect your own mouth. Where this is where you're going to put your mouth, and this is where you're going to put the person's face, right? So yeah. Please, okay, I've read that. Okay, so let's move on with the class. So it is very important as a first responder, or as a first aider, or as someone that has gone through this class, to always remember that there's always a chain of survival. And in every chain of survival, whether in advanced cardiac life support, or basic life support, or even the CPR that we are teaching today, in every chain of survival, the first point of contact are the first aiders, the first responders, and passerbys that can give effective cardiopulmonary resuscitation. So you can see how important today's class is. And that means what chain of survival just means is activation of emergency response, which means that you either call for help almost immediately, you perform early cardiopulmonary resuscitation, you use your AED if there's any in your vicinity. If there's no, you continue your cardiopulmonary resuscitation until help arrives, and then help then takes care of every other thing. So it is very important that you perform early cardiopulmonary resuscitation. And for every chain of survival step, a first aider or a first responder is very important. So how do you, somebody asked this question earlier, so how do you respond to a cardiac arrest victim? How do you know that the person actually had a cardiac arrest, right? The first thing is that you want to approach the scene safely. You don't just jump into a scene, like somebody mentioned in the chat box. The person was asking, what about the crowd? How will you jump into a crowd? Yes, you want to be sure that there is no anxious person beating up anybody or stabbing anybody. You want to approach the scene safely. You want to know if the cause of the cardiac arrest, was it an electric shock? You want to know if there's water on the floor, was it fire burning a building? You want to know if there's fire close to the person. So you want to approach the scene safely. The next thing you want to do is that you want to check response. I'm going to show you later in this conversation in a demonstration how to check for response. By checking for response, you want to tap the person, feel the person, look, right? You also want to now shout for help. So it's your response that will now know whether the person needs further help, or you can actually give the first aid to the person. So for example, if you check for response and the person is conscious, it means the person doesn't have cardiac arrest, right? It means maybe the person needs sugar, so you can give the person Coke bottle, a bottle of Coke, can give the person Gary water if you're at home. If you are not at home, you can give the person Coke bottle, a bottle of Coke, because it has enough sugar or glucose boost, right? But when you notice that the person is not bleeding, or the person doesn't have any pulse, which I will show you how to do later in this conversation, then you know that the person is actually not responding, and the person most likely has cardiac arrest, right? So you want to shout for help. And how do you shout for help? You want to call a toll-free number, which I'll be showing later in this conversation, or you want to call other people to support you in resuscitating this person. The next
Hello,
thing
Dr.
is you want to open the airway.
Hello, Dr. Sheung.
Yeah?
Okay, so sorry, sorry, cut in. I just want to let you know that we can do the pose when you're ready.
Okay, thank you very much. So let's just continue. Yeah, so you want to open the airway. How do you want to open the airway? You want to remove the person's tie, if the person is a man and woman tie, or if the person is a woman and woman. You want to try to open the airway as much as possible. You want to check for pulse and breathing. You want, when you're opening your airway also, you want to make sure that the crowd in the area, you want to disperse the crowd. You want to check pulse and breathing. I'll show you that later. You want to start your chest compression and then give rescue breaths. So like I mentioned earlier, just to elaborate, how do you want to approach scene safely? You want to know if it is safe enough to enter that area. You want to know hazardous elements on the scene, like I mentioned earlier, water on the floor, fire, what's the cause of the cardiac arrest? Was it actually fire accident? Was it an auto accident? Was it actually a robbery? Was it a crime scene? Is there a risk of secondary accident? Or did the person fall on the stairway? How do you want to protect the person not to fall further? What type of scene is it? Is it a crime scene? Is it a scene that you can actually enter? So you want to check all of that, right? Also for a rescuer, you want to know whether you need a backup, right? So are there other rescuers on the scene? You want to know whether other people can give cardiopulmonary resuscitation, such as yourself. As a victim also, is it a multiple casualty incident? It is very important that you attend to the one that needs it the most, right? So for example, if there's someone that is conscious and there's someone that is unconscious, a question fast, so please, you can drop in the chat box. Who do you want to attend to immediately? Is it the conscious person or the unconscious person? Let's just take one or two people, then we continue. So if you get to a scene, you check for scene safety. Now, you want to unconscious person. Yes, correct. So you want to attend to the unconscious person first because the person needs it the most, right? So as a victim, you want to attend to the unconscious person first. Now, as a bystander, is there a crowd in the scene? Are the bystanders hostile? Always note that in approaching the scene, if the bystanders are hostile, whether you are a professional first-class first aider or you can give professional CPR as much as possible or effective CPR, always know that you can always wait until the bystanders are no longer hostile before you get in. Because if they injure you, that means there are two people that may need help, right? So always note that. So let's move to the next slide. So how do you check for response? You want to check if the person is unresponsive. You want to tap and shout, "Are you okay?" That's the first thing you want to do. So you want to call the person's name and shout, "Are you okay?" If there's no response, then you call for help. You can call a toll-free number or tell someone else, because remember earlier we mentioned that you should not get distracted as much as possible. So you want to call someone else to call for error. And then if the person responds, leave the person in that position, find out what is wrong. If the person, like I mentioned earlier, there's not enough sugar in the person maybe has not eaten that day. So you can ask, "Oh, have you eaten this morning? What did you eat yesterday night?" You know that most likely this person has not eaten, so it may be hypoglycemia. What hypoglycemia just means is reduced sugar in the body. We need sugar to give us energy. And if there's no sugar in the body, the person can actually faint. So you want to give the person, like I mentioned, Coke bottle, Lucozade boost, or you want to give the person Gary water. But make sure, remember that when the person is unconscious, you're not supposed to feed the person anything. You're not supposed to pour water on the person's face, right? So that's it. And like I mentioned, if the person is conscious, after you've done all I've mentioned, you are reassess the person while you still call error. So you still have to call us. Now, the next thing you want to do is you want to check for breathing. You want to check for pulse. Now, you can check for breathing and pulse simultaneously. And how you do that is the method of look, listen, feel. So you look, you listen, you feel. And you look, listen, feel for normal breathing. If there's no breathing or you notice any abnormal breathing, how will you know if there's no breathing? The chest is not rising. So if you breathe like me now, just look at yourself, you see that your chest is rising as you breathe. So when you look and the person is not breathing, you know that the chest is not rising. Or the chest is rising, but it's not rising the way it's meant to rise. Maybe it rises and then after like some minutes, it's haphazard, it's not rising the way it is. Then that means it's most likely an abnormal breathing, which is equal to gasping. And someone going through cardiac arrest can actually gasp, right? So you also want to check for pulse. And how do you check for pulse? Look at my fist, right? Now, normally, I know when you watch movies a lot, most times when somebody is in cardiac arrest, they check the hand for pulse. No, that's wrong. When you want to check for pulse in the cardiac arrest, you don't check the hand for pulse. Forget. You check what we know as the central vein. That's when you check for pulse. And what central vein means is the middle of your body is your central part of your body. Now, central vein means that the vein that is closest to the central part of your body is the central vein. In this case, you can check the carotid artery. How do you check for carotid artery? Carotid artery is an artery that supplies blood to the brain directly. And so you want to be sure that the person is actually still has a pulse. And how do you check for that? Your hand, right? Put your hand in the midline of your neck. Then you can either move to the left or right, but I'll be moving to my left. Move to the left or right, and until you see a ridge. Once you see a ridge, press a little bit deeper into that ridge. Please make sure that you're not pressing both carotid arteries because that is dangerous. Once you press deeper, you should be able to feel your pulse. What pulse means is that you'll be able to feel something that's beating on your hand. Yes, I can feel mine. That is the carotid artery. So you're meant to feel that for 5 to 10 seconds, very fast, no waste of time. If there's no pulse, you check for breathing, there's no breathing. You check for pulse, there's no pulse. You start cardiopulmonary resuscitation immediately. Now, what is cardiopulmonary resuscitation? If I show you the video, I will stop sharing my screen so that you can see the demonstration. Please, you can follow as I also do mine. Like I mentioned earlier, let us do it learning by doing. So this is my dummy. I'm going to call my dummy Inamdi. This is Inamdi. First of all, we already said scene safety, right? So you check for scenes. The scene is safe. No electric wire on the floor. There's no water in this place. Fire is not burning. The crowd has been dispersed. I have another rescuer, I don't have any rescuer, I'm on my own, but this is inactive, right? So you check for scene safety. Now, immediately you want to call for help. You already check for scene safety. Whether the person has cardiac arrest or doesn't have cardiac arrest, you call for help immediately. And how do you call for help? You can call for help by telling another person to call ERA or to call an emergency number, and then you want to check for response. Now, we are going to be using inactive. Please note that the name we are using is fictional. So we're going to be using inactive in this class, and what it means is that when you want to check for response, you tap inactive gently. Let me bring the door closer. Please note that you're not supposed to move your door. I'm just showing you this so that. So you tap inactive gently on the upper part of the chest, more like the collarbone area. And what that means is that you are tapping inactive in a way that you are sure that inactive is sleeping or not. Inactive should be able to wake up. So you tap inactive, inactive. Can you hear me? If you can hear me, please shake your leg. If you can hear me, shake your hand. If you can hear me, shake your finger. If you can hear me, blink at me. Quickly, in 5 to 10 seconds, you're done with that. Maybe after that, the next thing you want to do is inactive is unresponsive. You want to look, feel, and listen to the breathing. How do you do that? You put your ear closer to the person's mouth, yeah, and then you look straight to the person's chest. While you're doing that, you're also checking for the pulse. So you can use your right hand, left hand, any point. So I'm just using my left hand. You're also checking for the pulse to know whether the person has a pulse. Now, inactive doesn't have a pulse, and I can't see any chest rise, but can I hear inactive use his mouth to breathe? So that means inactive is unconscious, right? Inactive is also not responding. So the next thing you want to do after that, you want to start what you know as cardiopulmonary resuscitation, like I mentioned earlier. Fast, remember, quick. And how do we do that? First thing is there's a combination. You do you do chest compression and then you give rescue breathing. For an adult, you give 30 chest compression and you give 2 rescue breathing. And why do you do that? The hand that you use most often, you put that hand on the person's chest. Now you're going to be putting it on the midline of the person's chest, not the left, not the right. And where in the midline are you going to put it? You're going to put it in the center part of the chest. And what does that mean? Now, if you touch the ridge of your neck, now go to your neck and move down a bit, you're going to see a ridge. Now, on that ridge is your sternum. Down, just keep moving down your sternum. You will now feel a very soft part. That part is a medical term. It's called the xiphoid process, right? So that xiphoid process is very soft. You're not supposed to touch that part because if you start compressing like that part, you can break the person's bone. So what you do is 2 centimeters above the xiphoid process where you put the heel of your hand, right? So you put your heel of your hand there, the hand that you use most often, you put it there, and then the second hand, you put the second hand to interlock the hand that you use most often. See, to interlock this way, the heel of your hand, or rather, the hand that you use more often, you interlock with the hand that you don't. Then you put the heel of your hand in the center of the chest, and then you compress. And how do you compress? You start compressing from your shoulder. So the power comes from your shoulder, not from your the middle part of your hand, right? So that you can give adequate compression. So you press from your shoulder. If you notice, my hand is not bending this way when I'm compressing. You compress from your shoulder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So you do up to 30, and then you give 2 breaths. And how do you give 2 breaths? You can give mouth to mouth, but like we said earlier, if you want to protect yourself, you can use a mouth guard. Now, this mouth guard can give adequate respiration to the person. How do you want to give adequate respiration to the person? You want to do what we know as head tilt. So you tilt the head tilt, chin lift with 2 fingers. So head tilt, you tilt with one hand, chin lift, you lift with the other hand, and then you give the breath. Now remember, the mouth guard covers both the mouth and the nose. But if it's small, and you want to still use the mouth gap, you can put it in the mouth, right? So then you now give 2 breaths. And how do you want to give the 2 breaths? You blow a balloon, like imagine you're blowing a balloon. So you give 1, 2, 1, 2, and then you continue your compression. 1, 2 to 30. You give 2 breaths again, and you continue until the upper rise. And if the person wakes before then, I should do just to make sure that the person doesn't fall back into cardiac arrest. So yes, that is that. Also note that if the person actually fell down, maybe due to trauma, it was an auto accident, or there was a punch in the person's face and the person fell down, or there was something that you feel like this accident or this emergency may affect some part of his head, do not do what we call head tilt chin lift. You don't do that. What you do is what we call jaw thrust. Why? Head tilt chin lift can cause more harm to someone that may have gone through a traumatic incident. In this case, maybe an auto accident. Auto accident means maybe a car hitting someone. So what you want to do is you want to open the person's jaw. So you want to put your hand this way, and then you want to open the person's jaw so that the person, you can open the person's respiration so you can give the person rescue breaths. That's for a traumatic person. But if even after you go through that, right, and even after you're trying to do a jaw thrust, and the person is still, it's very hard for you to actually open the person's mouth through a jaw thrust, please go ahead to do the head tilt chin lift. I hope I am clear so far. Please put in the chat box to know if I am clear so far and everybody's following, so that if I'm not, yes, okay, so I can continue. Yeah, so I'm going to be playing a video for everybody now. At least it will summarize everything we've said so far.
Welcome to the lesson on compressions. In this video, we will review the steps of giving chest.
Okay, everybody can hear, so let's continue.
Compressions. Compressions should always be given at a rate of 100 to 120 beats per minute and at a depth of 2 to 2.4 inches, that is, 5 to 6 centimeters. Compressing the chest slower than 100 beats per minute is less likely to provide enough circulation to the brain, heart, and other vital organs. And compressing faster than 120 beats per minute doesn't provide enough time for the heart to fill between each compression, which reduces the output as well. Similarly, pressing the chest deeper than 2.4 inches, that is, 6 centimeters, increases the risk of injuring the individual, and not pressing deep enough will not squeeze the heart enough to provide adequate blood flow. CPR always begins with compressions and then breaths. Rescuers who are uncomfortable performing mouth-to-mouth and do not have a mask may perform hands-only CPR and give compressions. For high-quality chest compressions, first position the individual on their back on a firm, flat surface. Then remove or open up clothing at the neck and chest area. Feel for the end of the breastbone or the sternum. Place the heel of one hand on the lower half of the breastbone. Avoid pressing down on the very end of the breastbone, as the bony tip, known also as the xiphoid process, may break off and slash the liver, resulting in internal bleeding. Put the other hand on top of the first hand. Press straight down at a rate of 100 to 120 beats per minute and at a depth between 2 to 2.4 inches, that is, 5 to 6 centimeters. Let the chest rise up completely between compressions. Your hands should remain in contact with the individual without bouncing or leaning on them. Proper CPR can be tiring. Ask to switch positions when tired if another rescuer is available to help. This concludes our lesson on compressions. Next, we will review giving breaths. Welcome to the lesson on...
Yes, I hope everybody's following. Before we continue, please can you put in the chat box if everybody's following? Somebody said 2 mouth breaths and 30 chest. If not up to 30, and the person jumped to life, I still don't. Yeah, so it has to be 30. 30 compressions. So it's actually, you start with compression first. 30 compressions and then 2 rescue breaths. Not 2 rescue breaths first and 30 compressions. 30 compressions first and then 2 rescue breaths. And you continue until there's a form of response. Even if there's a response, right, you still continue. Because sometimes while somebody is going into cardiac arrest or somebody is already in cardiac arrest, the person can gasp, right? And gasping doesn't mean that the person has come back to life. So you continue until help arrives. Yes, so that's that. Also, please note that it is important that even if there's another rescuer with you, you can always switch. So maybe you do 30 compressions now, the person gives 2 breaths, you keep doing 30 compressions, the person gives 2 breaths. At some point, maybe when you're tired, you can switch. While you're giving the breath, the person is doing the compression, right? You can always switch because adequate compression also means that, or adequate CPR also means that you are not tired. Yes. So let's continue. Steps during chest compression. Place the heel of one, like we mentioned, in the center of the chest. Place one hand or the other hand on top. Interlock your fingers. Compress the chest. The rate should be around 100 to 120 compression in 1 minute. That means you're doing about, there's 60 seconds in a minute, right? So in a second, you're doing about 2 compressions in 1 second. And the depth is 5 to 6 centimeters. It's more of like an imaginary depth, right? But how I picture 5 to 6 centimeters most times, when you are compressing and your compression, the chest is meant to bounce back. We call it recoil. So when there's a recoil, it's almost at that 5 to 6 centimeters. So you ensure complete recoil. And complete means that when it bounces back, before you press again, you wait a bit. And remember, in a second, you're supposed to give like 2 compressions. So remember when to give compression so that you give adequate compression. Complete 30 compressions, like I mentioned earlier, before you actually give your 2 breaths. For an adult, complete your 30 compressions first before you give your 2 breaths. Do not stop unless an AED is available. Victim move when substituted out. How do you give rescue breaths? Like we mentioned, gasping, like I mentioned, is a sign of cardiac arrest. Majority of people with cardiac arrest gasp. Do not stop chest compression if they gasp. How do you give rescue breath? You pinch the nose, if you want to give mouth to mouth. But if you have, like what I showed you, the mouth guard, you don't need to pinch the nose. But if you're giving mouth to mouth, you pinch the nose, you take a normal breath in. Let every one of us take a normal breath in. So you take a normal breath in, you place the lips over your mouth or over the person's mouth, or yes, and then you blow. So imagine you're blowing a balloon, you blow until the chest rises. If you're giving adequate rescue breath and you're following adequate head tilt, chin lift, you should be able to give proper blow that will chest rise. Take about 1 second to allow for chest to fall back, and then you repeat the second time before you go back to your chest compression. Hold 2 times. So let's take some pose. Emmanuel Rai will be showing us 2 pose because we missed the last pose. So you'll be showing them 2 pose this time. So please let's go with the first pose first, and then give the second pose. So Emmanuel, over to you. So first pose, in cardiac arrest, there's blockage in the coronary artery. Is this true or false? Your time starts now. So I'm getting a lot of true, I'm getting a lot of false. We are going to know the answer at the end of this poll. True is looking like it's going to win, but is that correct? Is true correct? 64% true. Is that correct? Okay, let's end the poll now because of time. Going to share. A lot of people chose true, but the answer is false. Cardiac arrest is total stop of the heart. It is heart attack that is blockage of the coronary artery. I'm going to share results. So the answer is false, not true. Emmanuel, please, you can go ahead with the second poll. Then we take some questions and then we go on with the conversation. Poll 2. A 65-year-old man is on a short ladder. A 65-year-old man is on a short ladder, changing a light and suddenly collapses. He is unresponsive. What is the next step? Number 1, call emergency services. Number 2, begin CPR. Number 3, begin mouth-to-mouth ventilation. Number 4, check for pulse. So it seems like checking for pulse is getting more answers. 26 people, 31 people, 34 people. Well, is that correct? So we may end the poll very soon. Emmanuel, please, you can go ahead and end the poll. So we'll be sharing the results with you, but the answer is actually you call for emergency services first before you even check for whether the person is responding or not. You call because you don't know what has caused the person to faint. You don't know whether it's cardiac arrest. You don't know, so you call emergency services immediately. First thing you're meant to do is check for scene safety first, but that was not listed here. The next thing after scene safety is call for emergency, call for help. That's the next thing after scene safety. Before you then check for pulse and respiration, and then you start your cardiopulmonary resuscitation. Let's take some questions and then we, Emmanuel, please, you can close this. Let's take some questions. Automated, okay, sorry. I'm trying to answer some people. How do you perform chest compression if it's a child? Wonderful, very valid question. We'll be showing you that in this conversation. Okay, somebody is telling them what AED means. That means this person has been paying attention. Thank you very much, Tolu Lope. That will do. Yes, AED is automated external defibrillator. It's safer to use a disposable face shield. This is something you can carry, yes. A disposable face shield is something you can also carry in your pocket, and it is very mobile. Thank you very much, Tolu Lope. That will do. Due to COVID protocols, okay, Tolu Lope has answered that already. How do you perform chest compression with diabetes patient? It's the same. If the person is an adult, the way I showed you is the way you do that. If the person is a child or an infant, there's a certain way you do that. I'll be showing you later in this conversation. Okay, let's take one more and then we move on. Okay, let's move on. If there is no more. Yeah. So we're still talking about an adult. So after you've done that, you've given chest compression as giving rescue breath, and then help arrive. So help hasn't arrived yet, but you use that AED on the person, maybe because there's an AED close by, maybe it's a bank, or even your estate and you people have an AED, or even your house and you have an AED. You can then put the person in recovery position because you are sure that the person is conscious. And what do we mean by conscious? The person responded to you when you called out to the person's name. The person could say the time, the person could say what day it is, the person could say the location of where he or she is. Then you are very sure that this person is awake. But you don't want to sit the person down, right? So you want to put the person in recovery position. And what does recovery position do? Now, when the person goes into cardiac arrest, the person is unconscious. There are many fluids that will be in the person's mouth. And you want to make sure that those fluids do not choke the person, and then the person now will go back to cardiac arrest. So you want to put the person in recovery position. And what recovery position does is it minimizes the, or rather it prevents vomiting or other fluids that can choke the person, and it minimizes that risk of vomiting. And know that if you think a person may have a spinal injury, do not move, do not attempt to move them until help arrives, because there are people, there are professionals that are trained on how to actually move someone that may have gone through a spinal injury. And how you're sure that the person may have gone through a spinal injury, maybe auto accidents, maybe a car accident, the person falling from a height, the person violently attacked, and so on and so forth. And what are the steps in recovery position? First, the person is already lying in supine position. And what supine position means that the person, By the time you start your cardiopulmonary resuscitation, the person is already lying by on his or her back, right? So you want to put the person's fist up on the floor this way. If you are by the right-hand side, you want to move the person's hand this way. If you are by the left-hand side, you want to move the person's hand this way. So whichever location you are, you put the person's hand this way. And then the other part of the hand where you are not, you bring the hand close to the person, where you place not the palm this time, but the back of the palm on the person's cheek. You also carry the person's leg from the knee area up, and then you gently move the person to your side where you are. The moment you follow this instruction, you are good to go. You know how to do recovery position. If you have someone close to you there, someone that is joining this meeting with you and you are together, you can perform recovery position on the person. So let's take that one more time and then continue. So if the person is with you, you put the person's hand their way, and then you put the other hand on the person's, remember it's not the palm, it is the back of the palm, on the person's cheek. You carry the person's leg up, but not the leg entirely, more of the knee, and then you move gently to your own side. If you follow that, you'll be able to give recovery position. If the leg in some kind of way is still touching the other leg, you can still move the leg to be forward like they did here. Pole 3 this time. So Emmanuel, Erai, please go ahead to give them pole 3. So pole 3, what method should be used to open his airway? Remember we mentioned someone that fell from the ladder. What method? He fell from the ladder. Remember, when somebody falls from the ladder, it's most likely a trauma to the neck. What do you want to do? Do you want to do a chin lift? Do you want to do a jaw thrust? Do you want to do a head tilt, chin lift, or you want to do a head tilt? I hope everybody answers better this time around, because so far, majority of people have filled the questions so far. Okay, this looks promising. A lot of people are saying jaw thrust. 18 people are saying jaw thrust, 90 people are saying jaw thrust. Is that the answer though? Let's see. I think we can end the poll now. Yes, the answer is jaw thrust. In any traumatic incident that you're sure that this person may have a spinal injury due to the accident, you want to do a jaw thrust, because a head tilt, chin lift can cause more damage to the person's spine. So you want to do a jaw thrust. And how do you do a jaw thrust? Bring the person's jaw down, jaw thrust. So if you now cannot do the jaw thrust, that's when you can now still do your head tilt, chin lift. But in a traumatic incident, you did the jaw thrust first. When it's not a traumatic incident, maybe the person was just walking on the street and the person just fell suddenly. You can go ahead to do your head tilt, chin lift. Yeah, let's stop sharing. Please, are we following? Let's take some questions before we continue. Oh, I didn't get the third poll on my screen. Sorry for that. Can we get the material for further studies? We'll look into that. How do you compress a patient who was operated a few weeks? How do you compress a patient? Even if the person is operated a few weeks, you are still going to revive the person. The only reason why you may not revive him by resuscitating the person is there are some people that on their chest, they may tattoo what we know as do not resuscitate. If you resuscitate that kind of person, the person can sue you, right? So if you open the person's chest by loosening the person's thigh and at least giving airway, proper airway or proper ventilation, and you see something on the chest tattooed, do not resuscitate, then our advice is don't resuscitate. But apart from that, you're meant to go ahead to resuscitate the person. How do you do compression on a pregnant woman? Yes, you can go ahead to do compression on a pregnant woman. When you're doing compression, it's the chest area you're doing the compression. It's not the belly area. No matter how big the belly is, whether it's triplets or quadruplet means 4 people, 4 babies in the womb. It can never touch the chest, so you can always do your compression on the chest. What do you do with someone not responding but they respond? If somebody is not breathing but there's pulse, you just want to, there's pulse and the person is not breathing, you just want to give the person rescue breath. And the rescue breath you want to give the person will not be the normal rescue breath that we've mentioned so far. You're not going to be giving the person 2 rescue breaths. Thank you for this question. Very, very, very interesting question. This time around, you want to give the rescue breath up to 10, you want to give 10 to 12 rescue breaths per minute. 10 to 12 rescue breaths per minute, yes. That's what you want to give to the person. Since there's pulse, the reason why you are trying to push the heart is that you're trying to push the heart so that the heart can supply blood to the brain and part of the body, but especially the brain. But since there's pulse, that means the heart is functioning. That means the person is not just breathing, right? You want to give the person rescue breath. And if it's the other way around, the person is breathing but no pulse, you want to do compression. But most times, if the person doesn't have pulse and the person is breathing, the person is most likely gasping. Yes. Oftentimes, like we always say, oftentimes a cardiac arrest occurs due to a heart attack. Please save our number for our toll-free number, by the way, for any help that you need. Let's continue with the class. Yes, so somebody asked a very valid question about how do you do compression and rescue breathing on a child or an infant. A child is 2 years and 8 years and above, while an infant is 8 days to 2 years. Some even say an infant is less than 1 year. But when you are trying to resuscitate an infant or a child, body size really matters, right? If there's a child that is as big as me, I don't know if you can see it wrong, but if there's a child that is as big as me, then you can as well just do an adult cardiopulmonary resuscitation for that kind of person, right? But if there's a child that is like a usual size for a child, they can go ahead to resuscitate following the child technique. And if it's an infant, you can go ahead to resuscitate following the infant technique that I will be showing you. So for a child, what are the similarities between adult CPR and a child CPR? The location for a child is the same location that you use for an the location for an adult is the same location you use for a child. And like I mentioned, you move down to the xyphon process, 2 centimeters above the xyphon. The xyphon process is that soft part. 2 centimeters above the xyphon process is where you're going to compress. But in another simple term, this is your nipple. The nipple line, just at the nipple line, if you trace your nipple to the center of your chest, just at your nipple line is where you can also compress, right? And the ratio of a child to an adult is the same. 30 compression to 2 breaths is the same as a child. But what is now the difference? Now in chain of survival, remember we mentioned chain of survival, which is there are 6 of them. Let me go ask, what is the chain of survival? Put it in the chat box. I will see whether somebody actually can get it. But let's continue, I'll check later. In the chain of survival, you perform CPR, and for the first 2 minutes, you can perform 5 cycles. And 5 cycles means you do 30 to 2 compression 5 times, right? And if you are in low, you can call error. Yeah, that's for a child. And the reason why this is that most children or most infants doing a cardiac arrest is most likely due to asphyxiation. And what that means is that it's most likely due to low respiration, right? And so if you can quickly start your cardiopulmonary resuscitation, even before you call for help, the person may come back to life in quotes. So you may not necessarily need to call for help before you start resuscitation for a child or an infant. Please note that. Another thing you need to note is that for a child and an infant, if there are 2 rescuers, you are not the only one. If you are the only one, you must do your 30 to 2. But if there are 2, and by 30 to 2, I mean 30 compressions to 2 breaths. But if there are 2 people, you do 15 compressions to 2 breaths, right? So you will do this 15 to 2, another person will take over, do 15 to 2. You continue to do your 15 to 2. That's if you are a double rescuer, right? You can always do that. But if you are a double rescuer and you decide that, you know what, let me keep compressing and let you be giving the breath, it's still going to be 30 to 2. So it depends on which one you do. For an adult, whether you like it or not, it has to be 30 to 2. Adequate chest compression for an adult and adequate rescue breath for an adult is 30 to 2. But adequate chest compression and rescue breath for a child and an infant, if you are double, it can be 15 to 2. Or if you are the only one, for an adult, you give 30 to 2. And the depth of your compression is not as deep as an adult. It should be about one third or half depth of the chest, which is about 2 inches. But you still use 1 hand, which is more comfortable. Now I'm going to explain to you. So let's imagine this is a child. Let me stop my share screen for just a bit. Let's imagine this is a child. You're not meant to carry the person up. I'm just showing you this, right? Let's imagine this is a child. Now, if the child is small, you know that your 2 hands can injure the child. You can use just 1 hand. So you just use the heel of your hand that you use the most on the chest and you compress. I'm still going to stand up to show you that. But if it's an infant, you don't use the hand at all. Rather, you don't use the heel of the hand at all. You use 2 fingers to compress. Now, a lot of people say you can use 2 fingers to compress this way. But why this is not good is that if you see how I'm compressing, you can see that the person's head is shaking. The infant's head is shaking. So you're not supposed to do this. This has been discouraged. So what you do is that the infant will be on a flat surface and you compress with 2 fingers. So I'm going to go back there now to show you. So let's imagine this is Inamdi, or Inamdi now is the child. So we just want to use one hand, the hand that we use the most to compress. So we want to do, if you can say I started like this is wrong. It is meant to be this way. So you want to compress. Now remember, you follow the nipple line. So you want to compress with one hand. And remember, it's always from your shoulder region. You don't bend your hand. You want to compress 1, 2, 3, 4 to 30 if you are the only one. If you are not the only one, 15. And for a child, or rather for an infant, this is an infant. Can you see my infant? So you want to use your 2 fingers to compress. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then the rescue breath is the same. Now, for a child, it's the same rescue breath you give. But for an infant, I'll mention that, I'll explain that later. Your mask should cover the mouth and the nose, and even the totality of the face, if it may lead to that. So that the child, or rather the infant, can take in all the breath that you want to give. Yes, so that's that. Let's continue by sharing my screen. Please, I hope you are following so far. Please put in the chat box if you are following, yes and no. Yes if you are following, no if you're not following. Yes, thank you very much, Ayodele Olawale. Let's move on to infant CPR. So what is the difference between infant CPR, adult CPR, and child CPR? Similarities with adult CPR is that if you are the only one, you give your 30 compressions to 2 breaths, right? And that's similarity between adult CPR and infant CPR. Similarity between child CPR and infant CPR is for the chain of survival, same reasons. You can perform your cardiopulmonary resuscitation first, even before calling for help. Reason why is that, remember we mentioned that earlier in this. Reason why is that most times it's actually respiration that is affected that can lead to cardiac arrest in children and infants. So you can start your cardiopulmonary resuscitation immediately, even before calling for help. Because most times, if you start your cardiopulmonary resuscitation immediately, the person can come back, right? Or rather, you can revive the person. But if you try and then by your first 5 cycles, and that means you've done your test 5 times, the person doesn't seem to be alert or come back, you call for help immediately. And if you are the only one, you can call by yourself and put it on speaker. We have technology now that can solve a lot of problems for us. Death compression is still the same. So there's still going to be the infant death compression is the same child compression, which we mentioned earlier to be 1/3 to half depth of the chest, which is about 2 inches, if you can remember that. So what is the difference with CPR? You perform chest compression with 2 fingers, like I mentioned earlier. You place your mouth over the person's mouth and nose. So if it's an infant, you're placing your mouth over the mouth and nose. You only puff air in. So remember we did take breaths in and then puff the breath out, right? For both adults and for child. But for infants, you don't want to also cause respiratory failure by giving forced air in. So you want to just puff gently. You don't want to first take your breath and then push it in to the infant. You just want to push the normal air in. No need to force it in. If unsure it's a child or not, I mentioned earlier that the size matters for cardiopulmonary resuscitation. If you notice that this child is very big, just do adult cardiopulmonary resuscitation for the child in quotes. If the child is like normal size child, go ahead to do a child resuscitation. If it's an infant, go ahead to do the infant. An infant most times they have the same size and weight. But if you notice that this infant looks very big, and that's somebody is maybe 9 10 months old, but the 10 months old is looking like 3 years, then you go ahead to do child for the person. Pole 4, Emmanuel, please go ahead with pole 4. While we're waiting for pole 4, I appreciate the recording. Yes, also please note that due to we took time to start all over again. This class will be ending by 8 o'clock. We apologize. And pole 4 says infant CPR for 2 rescuers are 30 compressions to 2 rescue breaths respectively. Is this true or false? Infant CPR for 2 rescuers are 30 compressions to 2 rescue respectively. So far, there have been 3 questions, and out of the 3 questions, 1 was gotten right, 2, majority of people didn't get the 2 right. So let's see if at least we can balance it by getting this right. Let's end the poll now. I'm sorry if you can't participate in this poll. We also have to not take too much time so people will not get bored and leave. So yes, a lot of people chose false, and yes, you are correct. A round of applause. So yes, infant CPR for 2 rescuers actually, it should not be 30 compressions to 2, it should be 15 compressions to 2 rescue breaths respectively. So yeah, all of you are correct. How for yourself? So let's stop sharing. Let's continue. Hey, can you hear me? Someone is saying that they can't hear me. Please, before I go ahead, before I continue, okay, you can, so let me just continue. So, AED training. It is very important that you have what we know as the automated external defibrillator. And this is the automated external defibrillator. This is the pad and this is the machine. Continue. What is automated external defibrillator? It is a computerized device. It can help you analyze heart reading, know whether the heart reading that it has analyzed needs electric shock, which means shockable reading. It will advise me to actually press the shock button. Very easy to use. It gives you prompts from time to time, so you don't even need to cram the steps. It will tell you what to do over and over again. So the AED will analyze the heart reading for you. If there's heart reading, the AED will not advise you to shock. If there's no heart reading, but the heart reading is looking some kind of way, it may advise and will not advise, depends. But if there's no heart reading at all, it's to advise a shockable reading. So you press. If there's something you press. So I'm just going to demonstrate speedily. So after I demonstrate, I'll show you that video and then we'll continue the conversation. So I'm going to stop my share again so that you can see very well. So in this use of AED, we'll be using an adult and we'll also be using a child. For an adult, immediately you have done your chest compression and then there's an AED around, or they bring an AED, like help arise and they bring an AED. You want to first put on the AED.
Adult patient. If the patient is a child, press the child button.
Now we are doing an adult patient, so we don't need to press the child button. Now I'm removing the cloth and then I'm attaching the pad. So it gives you an instruction when you attach the pad. I attach one here, I attach one here. I press firmly. I press firmly.
Apply pads as shown in the pictures. Apply press pads firmly on skin.
I press firmly.
Do not touch the patient.
So it's telling me now not to touch the patient. It's already analyzing heart reading.
Do not touch the patient. Analyzing.
It's analyzing heart reading to know whether to shock or not. It's advising me to shock.
Do not touch the patient. Everyone clear.
I'm now going to clear everybody. Please do. And it's telling me to press the flash button. I press and it gives the shock. Immediately it delivers shock. You begin your cardiopulmonary resuscitation immediately. You don't stop. You begin. So you do the 30 to 2 again and again. Yes, that's that for an adult. So I'm going to bring it closer to you so you can see. So in the pad, it shows where you need to put See this part now. It shows where you can put, so the instruction is there, where you can put for an adult, the first part, and then the second part. In the automated external defibrillator, it also tells you where to press. If you can see that green button, you press that green button. The moment you press that green button, it gives you the prompt. Now, if you're doing for a child, you press the green button. So I'm going to do for a child now. For the child, you can see you put one in the front, and for the infant rather, or the child, depending on the size, you put one in the front, and then you put one at the back. So the instruction is there for front and back, which I'll be doing now. So yeah, before you remove the pad, you put it on first. You put on the automated external defibrillator.
Is a child. Press the child.
Now I'm pressing the child button.
Child patient. Remove the child's shirt.
Now I'm removing the child's shirt.
Remove packet and apply pads on the child's bare skin.
One is to the front.
Apply pads to child's back
One
and
is to the
chest
back.
as shown in the pictures.
Press firmly.
Press pads firmly on skin.
Pressing firmly.
Apply pads to child's back. Press pads firmly on skin.
Pressing firmly.
Do not touch the patient. Analyzing heart rhythm.
Analyzing.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
That's advice for shock.
Do not touch the patient. Everyone clear.
Clear, please. Because it's very important to clear, so that, because that electric shock, so that it doesn't shock another person. Now you press the shock button. And immediately you press the shock button, you continue your compression.
Begin CPR.
1, 2, 3, 4, 5, 6 to 30 if you are the only one. And if you are not the only one, you give 15 to 2. So you're not supposed to be throwing the person that are trying to rescue this will forgive my violence. Yeah. So we're going to share screen now and we'll take poll again. Yeah, so let's watch this video. Let me be sure that I've put on share sound. Let's watch this video just to summarize everything I've said.
Welcome to the lesson on AED for adults. In this video, we will discuss the steps of using an AED. AED, or Automated External Defibrillator, is a portable unit that has a computer that analyzes the heart rhythm and determines if a shock is needed. An AED can deliver a shock to help restart the heart. Starting CPR immediately and quickly using an AED improves the chances of survival. The AED is very simple to use. Just follow the diagram or voice instructions given by the AED. It should be used anytime someone collapses, fails to respond and is only gasping or barely breathing. First, turn the power on. Expose the chest and apply pads on the chest. If they have a medication patch on their chest, remove it before applying the AED pads. If there's a bulge under the skin of their chest, a pacemaker may be present. Avoid placing the AED over the pacemaker and adjust placement accordingly. Connect the pads. Analyze the rhythm. Follow the prompts on the AED. The prompts include shock advised, no shock advised, and check connection. If you are giving a shock, make sure no one is touching the individual. Resume CPR with compressions. If the AED malfunctions or does not work, continue performing CPR until additional help arrives. If an AED is not quickly available, begin CPR and send someone to locate an AED. This concludes our lesson on AED for adults. Welcome to the lesson.
Yes, thank you for that. So poll 5 time. Emmanuel, please could you share poll? So we have to be a bit faster so that we can finish in time. The AED indicates shock advice. What is the next step? First, clear the area and deliver shock. 2, deliver 2 additional minutes of cardiopulmonary resuscitation. 3, ventilate while shock is advised. 4, assume error and do not deliver shock. Yeah, it looks like people paid more attention in this class. 100% of people are choosing one answer I will not mention, so that I can see whether more people will pick the answer or not. Still at 100%. Wow. Okay, one person has decided to pick another answer, which is wrong. But I think we're doing very well. Another person has decided to pick another answer, which is wrong. So it's now 93% picking the right answer. Okay, let's end the poll now. The right answer is, the moment AED indicates shock advised, you clear the area immediately and deliver shock. You don't deliver 2 additional minutes of cardiopulmonary resuscitation. You don't ventilate while shock is advised because it can shock you too. You don't assume error because the AED is automated. It's like artificial intelligence, so it advises you on what to do. Often, like we mentioned, the cardiac arrest occurs. Please save a number. So what is the role of Emergency Response Africa in the cardiac arrest? I think somebody was asking that question in the chat box. So how do you want to activate us? How do you want us to help you? You save a number, of course. So when encountering a person who is unresponsive, barely breathing or not breathing at all, you quickly call us immediately by activating our toll-free line. Remember, it's a toll-free line. So even if you don't have credit, if you don't have airtime, you can always reach out to us by dialing 08, very simple number to remember, 08 000 22 55 372, 08 000 22 55 372. And that is actually the first step in the chain of survival. In situations where a cell phone is not available, you can send a second responder or a bystander to call ERA so that the injured person is not left alone. Also, like we mentioned, tap to know whether the person is okay. If you fail to respond, yell for help, tell somebody to call ERA and get an AED if possible, or even a first aid box. Stay on the phone until the ERA dispatcher tells you what to do. We also offer phone first aid. So if you call us, we can actually advise you on what to do before help even arrives. So remember our number 08 000 22 55 372. In summary, it is very critical to remember that calling emergency numbers, in this case, ERA, may be the most important step you can take to save a life. If someone besides you is present, they should dial ERA immediately. If you're alone with the victim, try to call for help prior to starting cardiopulmonary resuscitation on an adult and after a minute on a child. Story. So we have a story again. So this story is, Inambi complained of a slight headache and chest pain in the morning, which was radiating to his shoulder. He decided to go to the bank to make some transaction. On his arrival, he collapsed and stopped breathing. What will you do after today's class? You put steps in the correct order and post in the chat. So put the steps in the correct order. Like the first thing you do you want to check for pulse and breathing first? Do you want to start your cardiopulmonary resuscitation first? You want to call for help first? You want to check for response first? You want to ensure safety first? Do you want to then, after maybe ensuring safety or maybe calling for help, start your CPR? Just put them in order. So I'm just going to take. Okay, so let me just say because of time. So the first thing we want to do is that we want to ensure safety first. After ensuring safety, you want to call for help. Then you want to check for response, and you want to start your CPR. Rather, you want to check for pulse and breathing, and you want to start your CPR. I'm going to say it again. You want to ensure safety first. You want to call for help. You want to check for breathing and pulse. You want to start, and you want to check for response. You want to check for pulse and breathing, and you want to start your cardiopulmonary resuscitation. The goal of this CPR and AED lessons has been to properly educate people, to properly educate you, to be able to assist someone that is experiencing cardiac arrest. Through these lessons, I hope that you learn to identify, number one, assess, number two, and respond to emergency situation using the cardiopulmonary resuscitation technique and also the automated external defibrillator. O6, which is the last O for the. Please, Emmanuel, let's go ahead. While we wait for Emmanuel, yeah, thank you very much. A lot of people are putting the answers in the chat box. CPR for neonate. Neonate.
Okay, Dr. Sean, for the brevity of time, can we just keep O6 quickly?
Okay.
Thank you.
Thank you. But let me just quickly answer that question. For you use the same CPR for infant for neonate. Yeah, Emmanuel, you can go ahead now. Emmanuel, are you there?
Yes, please, I'm here. Sorry, can you come again?
Yeah, you're supposed to go ahead, just.
Okay. Thank you very much, Dr. Sean. So I think we have come to the end of this first part. Thank you very much. Please, can we just put a thank you in the chat room for Dr. Sean? Thank you very much. Just say thank you to Dr. Sean. Thank you for this awesome session. Yes, thank you to Dr. Sean. Thank you, Dr. Sean. Yes, a lot of people are asking about, Dr. Sean, please, can you stop sharing your screen, please? So a lot of people are asking about ERA services and several things about ERA. So we'll just take these few moments to talk about that, just a few minutes, and I bet you're gonna have an exciting time. Sorry, just a minute. So I'm going to introduce someone very, very important in this next session. That is, sorry, hold on. Okay, so I'm going to introduce someone who is very important to us. This is our CEO of Emergency Response Africa. Her name is Folake Owodunni. She's the co-founder and CEO of Emergency Response Africa, which is a health tech startup, and we're changing the way that medical emergencies are managed in Africa. ERA is actually building the largest network of first responders, emergency vehicles, and hospitals, connecting people in urgent need to help using technologies, pardon me there. So Folake has a master's in global health and development from the University College London and a master's in business entrepreneurship and technology from the University of Waterloo in Ontario, Canada. She has over 12 years of experience working in healthcare, marketing communications, and management consulting with companies in Nigeria, the United States, and Canada. She's certified as a first responder with the Canadian Red Cross, and she's passionate about making fast, reliable medical emergency care accessible to all Africans. So I'm sure you're going to learn a lot in this short session. Just pay attention as we give the floor to our CEO, Mrs. Folake Owodunni. Thank you very much. The floor is yours, ma'am.
Okay, thank you so much, Emmanuel. Dr. Sean, if you don't mind sharing your screen again. First of all, I want to thank the 114 or 15 people that are still here at the end of the session. I fully acknowledge that at the beginning it was quite rough. There were challenges with the Zoom link. So I appreciate all the patience that everyone has showed and the fact that you've stuck with us through to the end of today's session. So my name is Folake Owodunni. I'm the co-founder and CEO of Emergency Response Africa. And I wanted to take a few minutes at the end of the session to share my own personal experience and hopefully articulate why we exist as an organization, as well as a special offer that we want to provide for everyone who took the time to be on this session. So, can you click to the next one, Dr. Sean? Okay, so this is a picture of my son. A few years ago, my family experienced a medical emergency in the middle of the night with my son. It was a very scary experience. I'm sure several of us on this call are parents ourselves, and we know that whenever anything happens to our children, we will do anything in our power to solve their problem and make sure that they're okay. Fortunately for us, we were living in Canada when that incident occurred. And we did what we all see in the movies, which is we called 911. Within a few minutes, there were 2 paramedics who came to our home. They brought their ambulance, they attended to him, and thankfully it turned out to be a very minor issue, and we didn't even need to go to hospital. But that experience opened my eyes to the fact that, in our Nigerian experience, we don't have such a system, or at least what we have is not truly reliable. And so we decided that, okay, is there a way to provide something similar so that people have confidence that when an emergency occurs, there's somebody that they can reach out to? Can you click to the next slide, please? So this is a picture of my grandmother, my father's mom. Earlier this year, she had a medical emergency, but it was a different experience because this time they knew about Emergency Response Africa and they had a number to call immediately, and she was able to be attended to. What Emergency Response Africa does is that we have a toll-free helpline that anyone can call and speak to a qualified emergency care medic. That person can start to provide the first steps of phone first aid while dispatching a first responder as well as an ambulance to attend to the scene. Now, someone asked a question earlier about how do we address the issue of traffic, especially in a place like Lagos and several of the big cities. And one of the ways that we address it is that we're building a network of first responders, ambulances, and hospitals, and we're connecting them using technology. What that means is that when you have an incident, we're sending to you the closest available first responder or the closest available ambulance. Some of our first responders also respond on a motorcycle, which means that they're able to cut through traffic and get to the scene quickly. That is definitely a time saver in a place like Lagos. And so when we started this company, we wanted to make sure that this service could be available to as many people as possible. But we all know that emergency care is expensive. Getting an ambulance can be expensive. And so we're trying to find ways to make it more affordable. And so what we've done is we've introduced some subscription plans, which I want to quickly share with everyone and then close out with the talk about training, because we got a number of requests for certifications with regards to the training. So please go to the next slide. Okay, thank you. So I want to encourage everyone to take some time to visit our website. You'll be able to see our plans. What we offer are 3 different plans that individuals and families can get in order to prepare for emergencies. We're very used to waiting until something happens or saying God forbid and hoping that something never happens to us. Rather, we are trying to encourage people to be proactive about preparing for emergencies by getting one of these plans. So the most affordable is, of course, the emergency aware plan. And at 2,500 Naira per quarter, it allows you access to that toll-free helpline and start to get any questions that you have answered. And at the core of it is, if anything happens, you don't have to handle it alone. You have support. The second tier is the emergency ready plan. In addition to the benefits of the emergency aware plan, you can also get referred to hospitals that we ourselves have verified as emergency ready. And let me explain how important that is. More than half of the people that go to any hospital are turned away or they are delayed. And that's simply because we have a system that there's not a lot of communication. And so what we've done is that we've identified hospitals that have the right tools, equipment, the resources to be able to attend to emergencies, but most importantly, also have the willingness to attend to those emergencies without too much delay. And so what people in the emergency ready plan are able to accomplish is when they reach out to us for that support, first of all, we can dispatch a first responder or an ambulance for an affordable call out fee, but then they are also then able to get to a hospital that is prepared to respond to the emergency. And then the third plan is the emergency proof plan, which is our most comprehensive. And the benefit of that plan is that if anyone has any emergency that's covered by the plan, you're not going to have to bring out any additional money from your pocket. And we know from experience that sometimes it's that having to pay at the time of the emergency that tends to be the most concerning part for people. So these 3 plans are available, and we want to make sure that everyone on this call has the opportunity to register. One thing I'll just say is emergencies are very easy not to plan for. They are, in fact, it's like I said, it's easy to have the God forbid mindset. But when they come without warning, and they cost significantly more than they would have if you had planned ahead. which is why we have these plans available. Please go to the next slide. Next slide, please. Perfect, thank you. So this highlights all of the benefits that we have with our plans in one place. You can see that we're available 24/7, 365 days a year. You don't even need to have credit in order to speak to the emergency care paramedic. You can access our mobile request app, which we'll be releasing shortly. And we send first responders to attend to you at the scene, as well as refer you to those emergency-ready hospitals. You have access to what is becoming the largest network of ambulances. And one benefit that we're really excited about, and I think would be very interesting for everyone on this call, is access to free training and certification, internationally recognized, which I will talk about on the next slide. But I also just want to emphasize that the benefit of having a plan like this is you get all these value-added benefits, but most importantly, you don't ever have to do it alone if an emergency occurs. Sometimes we get questions around things like, okay, what if I already have an HMO plan? So I can go to the hospital and the HMO will take care of it. Why do I need that additional emergency care cover? And what I would say there is we know from experience that there are many people who have HMOs. In an emergency, they reach out to the HMO, and not because the HMO does not want to help, but because emergency care is a difficult one to coordinate. They tend to get the message, okay, find your way to the hospital. When you get there, we'll take care of things. And what we know is there are many people that never actually make it to the hospital. So the goal for us is to make sure that not only do you have care from the scene of the emergency, you are transported in the appropriate way, and then when you get to the hospital, your HMO plan can take over. The other thing I will say is we are actually working with the existing HMOs so that you don't ever have to have a separate emergency plan. It really should come together. What I would suggest is if you already have an HMO plan, nothing stops you from reaching out to your HMO and asking why our services may not be a part of their package, or asking if our services are a part of their package. So the final thing I'll say here is our website for the plans is www.emergencyresponseafrica.com. Someone will post it in the chat as well, but /our plans. And that will allow you to see what those plans offer. And I encourage you to subscribe today. Can you just go to the next slide? We're almost done. So, in response to this session, we held this session for free because we fundamentally believe that everyone should at least have a basic knowledge of CPR and first aid. Even if all you can do is activate that chain of survival, you've already done something. But in the process of preparing for this session, we started to get a lot of questions about, can I get a certification? Can I get a certification? And so what we've decided to offer is that anyone who is able to subscribe to our plans between now and the end of the day tomorrow, so midnight tomorrow, Sunday, you will actually get access to an internationally recognized certificate of a CPR, Aed, and First Aid course, as well as a basic life support course. Can you click through to the next set of bullet points, please? Okay, so what you'll see here is these are two separate courses, and if you try to take those courses anywhere, it's going to cost you at least 70,000 Naira. But we have a partnership that allows us to offer that to you for free for those that are subscribed to our plans. So I'll say it again. Take some time today, visit our website, www.emergencyresponseafrica.com/our plans. And when you do, you'll be able to see what the options are. Choose an option that matches your family's needs, as well as an option that matches your pocket. The one thing I will say is we recommend comprehensive coverage if you have a family that has perhaps very young children, or you have a family that has maybe your elderly parents are living with you or they're living somewhere else and you want to make sure they are covered. In those cases, it makes sense to have a very comprehensive plan. But perhaps if you're relatively healthy, there's not really much happening and you just want to have some base level of peace of mind, then you can go for the more affordable plans. Typically, we don't make these trainings of this training and certification available for free, but because there's been so much interest in this particular session, we want to tie it to those that are able to subscribe can get access to these certifications for free. So I'll remind you, the deadline for that will be tomorrow at midnight. Anyone who subscribes by then will get access to those. And if you subscribe afterwards, we will welcome you to the family. We'll be very happy to have you. But that training will not be available, at least not for free. So can you just finalize and go on to the next slide, please? So this is the call to action. I believe Dr. Sheung had mentioned earlier that the least you can do at the end of today's training is to save the ERA toll-free line to your phone number contacts. I believe that's the least any one of us can do, but I want to encourage you to take it a step further because of all the benefits that we've talked about. Actually go on the website, the link is on the screen. Take some time to register and tell your family and friends about it. The more people are covered, the better chance we have of preventing unnecessary deaths. Whether it's an accident, whether it's a medical issue, our job is to make sure that when an emergency occurs, we're there to support you from the moment you place the phone call. You've already taken this step to stay with us for this training, and I encourage you to stay through, to see it through to the end. If you do subscribe, please note that we'll follow up with you this week to complete your registration. But I think at this point, I will stop because we're already over time. I want to thank everyone for being here with us today. I see some questions that have come up in terms of what is our geography of coverage. Our emergency aware plan, Dr. Sheung, if you can go back to the slide that shows the plans. Let me just articulate it before we round up. So please go back to the previous slide. Previous slide, please. Okay, so the emergency aware plan is available nationwide. That's the most affordable plan because what it means is it provides you a direct link to be able to speak to our first responders and get that initial phone first aid while they provide you that additional support. The emergency ready and emergency proof plans are currently only available in Lagos, Abuja, and Port Harcourt. So we are expanding and we are going to ultimately make all the plans available everywhere. But as of today, if you're not in Lagos, Abuja, or Port Harcourt, the only plan that you are eligible for is the emergency aware plan. We want people to be able to get a plan where we can deliver on the promise. And right now, we're only able to offer the 2 higher tier plans in Lagos, Abuja, and Port Harcourt. Hopefully that answers your question. But if you're anywhere else in the country, you can definitely subscribe to the emergency aware plan. Thank you so much. I think we can take any additional questions, whether it relates to the topic of today's conversation or to ERA itself. Thank you all.
Thank you very much, Ma. Thank you very much for your time. Thank you. So if you have any question, kindly drop it in the chat box and then we attend to you. We have less than 5 minutes to round up this entire session. So if you have any question, please, and do not hesitate to visit our website, please, www.emergencyresponseafrica.com. So we also have the plans, our plans page dropped in the chat room. Someone is asking how can you? Okay, just hold on. I will take them one after the other. So
there are a couple of questions that I can answer, Emmanuel. Okay. I see one question about if someone does not subscribe, how much is your medical evacuation? The short answer is that it varies very widely. It can be as low as 45,000 Naira. It can be as high as 120,000 Naira. It really depends on the circumstances of that evacuation. But the benefit of having a subscription is that you can then have access to whatever the needs are without necessarily needing to bring out extra money from your pocket, or you can access a more discounted rate. We want people to anticipate what could happen and hopefully pay a lower fee in order to access the care that they need down the line. So hopefully that answers your question, Malaki. Someone asked, do you get to Ibejuleki area? The answer is yes, we do. How can one get the CPR Aed certificate? So that's something that we can provide access to, like I mentioned earlier, for those that are able to subscribe between now and the end of day tomorrow. You will get access to that training and certificate free. And the benefit is that you can get it from anywhere. What is your emergency toll-free number? Please, Emmanuel or Dr. Sheung, kindly type the number in the chat so that people can copy it and save it. I encourage you, please save that number, share it with friends and family. Just let them know that if you have any emergency, here's a number that you can call, and at least it's the first step in getting help. But again, please remember that a lot of the benefits really are only available to those that subscribe. There's a question about, do you collaborate or relate with emergency agencies in Nigeria? Yes, we do. So we interact with a number of other emergency areas, and it depends. So for example, if there's a fire, at this time, we don't offer a fire service. So what we would do is we provide referrals to agencies or other services that are close to the location of the incident. Hopefully that answers that question. After subscribing for the plan, can we get the certificate? Yes, so after subscribing for the plan, yes, absolutely. You would get access to a course. So you have all the details of the course materials, and you will also get a certificate. And I like to joke about this, but the benefit of getting that internationally recognized certificate is that if it's something you need for your workplace, then that certificate is legitimate. Now, if you provide the certificate of participation from today's course, it is a certificate of participation. It's nice to know that you've attended, but if you need a certificate that shows that you are certified with a certain skill set, then that would be the one that we can provide with those that have subscribed. Is it compulsory to pick a plan before training? So it's not compulsory, but if you do want access to the training for free, then yes, it is part of the benefits that we offer to those that are subscribed. But you can definitely get training without actually subscribing to our plans. You would just have to pay for it. And I believe we can share information about that later.
I think someone is asking, does the emergency aware cover the free training?
Yes, so that's part of the benefit for today, and that's why we've set that deadline. Normally, we would not make it available with emergency aware, but for today, if you subscribe to any of the plans, then yes, we would make it available. Please visit our website. For those that are asking questions around how to make the payment, go to the website link. If you can kindly post the link in the chat again, www.emergencyresponseafrica.com/r-plans. Please go to the next slide. It's written on the next slide. Have a look at it. There are some people that have talked about wanting to work with us. Thank you so much. We are definitely building and growing our network, especially as we start to go into other locations. So please connect with us. If there's nothing available in your area at the moment, it doesn't mean you shouldn't stay connected, because there have been people that maybe initially we couldn't work with them, but after some time, as we expanded, we were then able to work with them. Someone asked, it's yearly, right? Not one-off. That is correct. So if you look on the Our Plans page, which is on the screen, you'll notice that it's 2,500 per quarter for the emergency aware plan. That means that in a year, it's 10,000 Naira. And I like to ask the question that what is it worth? Because many times we say to ourselves, 10,000, 10K, I can use 10K for this, I can use 10K for that. What if, no emergency occurs? And you are very right. What if nothing happens? Thank God for that. But what we always like to say at ERA is, okay, what if something does happen? Then what? And then you end up in a situation where you look back and say, could I have saved perhaps a life? Could I have saved perhaps money simply by making that choice to have that subscription? So please, let's keep it in view of what is it worth to us to be able to save lives if something does happen. How much is subscription? Please go ahead. Yes, a quarter is 3 months. Please go ahead to check the web page, because then you can see it. Do you cover live events? I believe you mean as, do we provide an ambulance for events? Yes, we do. We provide first responders and ambulances. We also do training for organizations and groups. Really, anyone who has a request for additional services, please just connect with us. Emmanuel can put the email address in the chat. Any other questions that I still see a few questions about how much is the subscription? Please visit the website. The website link is showing on the screen. Do we do commercial training? Yes, we do. Those of us on the fringes of Lagos. So what I will say is if you're anywhere in Lagos, we can get to you. But of course, you yourself know that it may take us longer to get to you just by nature of the way that Lagos operates. But if you are in Lagos, we can definitely get to you. Thank you so much, Charity. It's nice to see some people working with the Nigerian Red Cross. I was a Red Crosser as a very young child, and I always loved being part of the Red Cross Society. So it's very nice to see some people from the Red Cross here as well. The plans are paid quarterly. Yes, that is correct. So when you subscribe, you can use your card, but you can also pay by bank transfer. What we would encourage you to do is please just take some time to read what's on that page so that you fully understand what the plans are offering before you make your choice. Someone is asking about the CPR Aed certificate that is internationally acceptable. Yes, that is something that we can provide for those that are part of the subscription. You will not have to pay separately for the certificate. Mike is asking, is the payment per individual? The answer is actually no. So what we're doing is we offer plans that can cover a household of up to 4 people. So the only catch is they must be a part of the family. They must be living in the same household. So if they are not, and perhaps there are more than 4 people you want to cover, then what you can do is send us a message, perhaps send us an email or reach out to us on WhatsApp, which some of you have already been doing, and then we'll be able to work with you to find out what the right option is for those that want to cover more people. I think I've been talking too much now, so maybe I'll stop and let Emmanuel come up, and if there are any additional questions, we can.
Thank you very much, Ma. Thank you. So I think we are actually doing a very great job. So I would just like to ask you, if you have any questions, just drop it in the chat box, chat room, and just let us know your experience from today's session. What did you learn? What were the most important things you learned? Your take home and your testimonials. Just send it to us. Just drop it in the chat room. Let us hear from you. And please do not hesitate to visit our plan page. It is very important. It is very important. That is, you can learn a lot, you can know a lot from this, but it is highly imperative that you subscribe to any of our plans. At least the emergency aware, which is 2,500, is just a meager sum of money, but it can go a long way to help you. It can go a long way to assure you that you have someone to look after you, have a group of people who have your back to provide medical emergencies to you at any point in time. Kindly visit our page, www.emergencyresponseafrica.com//our plan plans. So I'll drop it again in the chat room. Please just click the link. And if you have any question regarding training, I see a lot of people are interested in training, like one-on-one training. I'm getting a lot of inquiries. Please send us a mail at contact@emergencyresponseafrica.com. I read that again and I'll drop it in the chat room. contact@emergencyresponseafrica.com. Please, and we'll get back to you. So just let us know. Yes, the plans are quarterly. I'm seeing a lot of questions. So just let us know, what did you learn from today's session? What did you learn from today's session? And don't forget to subscribe to our plans. It is very important you do so. It is very important you do so. I'm hearing from Oluwaseyi Wolabi. The sessions were awesome. Thank you very much. Thank you very much, Sheyi. We appreciate it. Do not forget to subscribe to our plan. It's very important. Yes, you'll get a recorded version. We'll send you an email. Kindly ensure that you drop your email if we know that we don't have your email, because a lot of us here are actually did not go through the normal route of signing up. So if you don't have your email, if you know we don't have your email, just drop your email and we'll send you the recorded version. Thank you very much. Thank you very much. Thank you very much. I'm seeing a lot of them. Was educative. Thank you. Also, do not hesitate to subscribe to one of our plans. It is very important. It is highly important you subscribe for your own benefit and for the benefit of your loved ones. So ensure you sign up. Ensure you sign up. So since somebody dropping me a message, so can I sign up using the application? We'll get back to you on that. But right now we're going through our website. So I think it's advisable you just sign up to our website. Our mobile app is still in development and to be launched soon, very soon. Have learned to save
Yes, Emmanuel, let me just add something there that, yes, please,
okay.
The primary way to sign up today is to go through our website. You'll see that you can pay with your card to the subscription plan, or you can do a bank transfer. Either way, you'll get access to the service. So I just encourage everyone to visit that web page and read through the details on the page so that you know all the details, and then you can make your subscription. Please keep in mind the deadline in terms of the offer that we have for training. Dr. Shem, if you don't mind going to the page where we talked about it, we want to give people access to that internationally recognized certification, and we have the capacity to do it free of additional charge. Go forward, please. Free of additional charge to those that are able to subscribe by tomorrow, end of day. So I'm really looking forward to seeing some of those that will be able to subscribe and getting you onboarded to complete the training and certification. Thank you all so much.
Thank you very much, Ma. Thank you, everybody. Thank you for your nice work, your nice comments. I would like to work with you. I need certification as well as good job. Okay, yeah. So don't hesitate. Just go subscribe right now. The page has been dropped. I've just dropped the page. So just click on the button, go through it, and then subscribe. About the training, is it physical or online? Is it going to be physical or online? The training is going to be online.
So yes, so the training is online. It's delivered online. It's a complete course of resources that's delivered over several hours. It can take a full day or an additional day to complete. And once you've completed the training, you will be given access to the certification. And this is something that is internationally recognized. This is actually not, it's not just something that we've put together. We've partnered with an international organization to make it available. The bank account details are available on our web page, but I think we can actually copy and paste it in the chat here for those who want that information. Emmanuel, are you able to copy and paste it in the chat so that those that are not able to find it on the page
I'm sending it to you. So I'm just sending the steps that you need to
Thank you.
Make your payment through bank transfer. So I'll just send it to you right now. So in case you're interested in making your payment through bank transfer, do not hesitate to okay, just kindly check the chat room in case you're interested. I'll send the entire details there. Thank you very much. Thank you very much. Thank you very much. Just keep the transfers coming in and then keep your subscription plans engaged. You have high level value. You have over 70,000 worth of value given to you at a very cheap rate. So do not hesitate to take advantage of this opportunity, as it will expire by October 31st, midnight. So ensure you take advantage of it now. And if you know anyone who is interested, kindly send the person our link or our numbers or any of our website details, including our plan page or our website. So yes, go ahead and fill the form. Yes, please, go ahead and fill the form. You can make online payments, you can make the bank transfer, so we're that flexible. How can you subscribe? Okay, 2 steps to subscribe. Number 1, visit our page. Number 2, choose any of the plans. And then number 3, I'm adding the 3rd step. Just make the payments. Those are the 3 steps. So charity, so how to subscribe? Visit our page. And then choose any of the plan. I'm attaching the link of the page you need to visit there, www.emergencyafrica.com. And then you visit our plans page. Then number 2, you choose any of the plan and then make payment. Number 3, subscribe. That's easy. Okay, I'll send details of all the payments to the group right now. So kindly visit our plans page and then details of the payment. I'm sending it to the group right now. So you can actually make your decision immediately. No, you need to, yes, can someone pay quarter? That is actually what we did. We made it that easy. So you're actually subscribing per quarter. No, you can't move on if you don't click on your card. No, if you don't want to use your card details, we have our bank transfer. So you can actually do the bank transfer. So we have that flexible option. So you can actually do the bank transfer. I'll be dropping the bank account details now. So we actually do the bank transfer. You don't need to be tied to one mode of payments. So I actually dropped it earlier, but I'll be dropping it again. Your email will contact you via email because you're sending it via to us. So it depends. If you're sending it via online, if you're making payment via online transfer, all you need to do is just make your payment and then you will contact you because we have your email because there's a field where we ask for your email and your name. So you're not presently in Lagos, there's no problem. It's online, the training is online, we cover you. So secondly, back to the person that's asking how we can reach them. So if you are making via bank transfer, all we need to do is just follow the steps, make payment to our bank account, send proof to this email, contact@emergencyresponseafrica.com, and then we'll send you a form and then take it from there. Thank you very much. Thank you very much. So I'm happy you understand now. So just remember you have up to October 31st, midnight to make the payment. And it's very, very flexible per quarter, very cheap. Okay, we're going to close in the next 5 minutes. So while you're making your payments, while you're making your subscription, don't hesitate to drop kind words to Dr. Sheung and Mrs. Folake. Just drop your kind words to them. And do not hesitate to follow us.
Emmanuel, let me just say one more thing, please.
Okay.
Please note, the plans are not cheap. They are affordable, but they are not cheap. And the reason I say that is there's a lot of value that goes into being prepared for emergencies and having a system that's accessible to you 24/7, 365 days a year. But we also know that we're in Nigeria and times are hard. So we actively make the plans affordable, but there's a very big difference between affordable and cheap. So if someone is looking for cheap, then I don't think Emergency Response Africa will be the right place. But if you're looking for value, then yes, 100%, we make that available in our affordable plans. So please, I want to just emphasize that, because no matter what, good quality healthcare is not cheap.
Thank you very much, ma'am, for that. Proof of payment to WhatsApp. Kindly send it to the email, please. It's better that way. Just send it to the email. Also, do not hesitate to follow us on our social media, across our social media platforms, on Facebook, on Instagram, on LinkedIn, and on YouTube, because we're going to post this training on YouTube as well. So do not hesitate to follow us on all our social media platforms. And like our CEO just said, medical emergencies are not actually cheap. We are affordable. We're making these plans affordable for everyone to be able to take advantage of this opportunity. Thank you very much. Okay, we'll be closing this meeting in the next 2 minutes. So if you have any question, comment, or whatever you need to get clarification on, just send us a message on our chat room. And I just sent to you our YouTube channel, so you can actually subscribe to our YouTube channel and get updates as well. And kindly follow us across all our social media platforms. We'll be closing now. And please do not just exit the WhatsApp group, as we'll be sharing updates and relevant information via that group. It is much more easy, or it's easier for you to, thank you very much. It's easier for you to check your WhatsApp than checking your email, because a lot of people rarely go to their email in Nigeria. So it's easier that way. So do not hesitate, do not just exit from the chat from there. So we're closing the meeting now. Thank you very much. Thank you very much. Thank you very much. God bless you. Have a great night rest, everyone. Bye.